Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Science. Today we are going to see a topic on tuberculosis, which comes under pathology of lungs. So the tuberculosis is a global disease which affects about 10 million people affected annually, which is according to the WHO, World Health Organization's criteria. And it is a chronic illness which affecting the nutrition, work capacity and the social stigma of a patient. So what happens actually in tuberculosis, it causes a drug resistance which increases about 30% of globally. When this occurs, automatically the drug response to the body will not occur. So automatically the patient may have died, which is about 95% of the TB deaths occur in a low middle income countries. Why? Because there is no much awareness about tuberculosis and it's spread over and it can causes a drug resistance where the drug cannot able to act on the patient body. So what is tuberculosis? It is a disease which is caused by the Tuberculosis is a disease which is caused by Mycobacterium tuberculosis, which causes an effect in the body which affects the total lungs. You can see in this image the active TB can be spread all over the lungs. It can damage the lungs. So once it causes a damage to the lungs, it can be a metastatic which can spread to any parts of the body and can damage the other parts of the body. By activity, the latent TB is asymptomatic and non-infectious. But the active TB is asymptomatic and infectious. By the location, the TB is mainly affecting the lungs with 85%. And in extrapulmonary, other than the lungs, it can start affecting the other regions, where you can see it can affect the lymph nodes, blood, CNS, pleural and disseminated areas. So here is a pathophysiology of how the TB affects our body. So once the TB has been entered into the lungs, our body will start giving a response which is called as immune response. So innate response, the macrophages react, the tissue necrosing factor will all produced. The adaptive response will occur 2 to 3 weeks where the CD4 cells of T cells will develop and it can cause a macrophage activation to kill the TB. So all the cells together to form a clump where the macrophages, epithelial cells, Mycobacterium and the WBC cells will clump together to form a granular formation. Where the mycobacterial evasion occurs, where that can be prevented with phagocytosome fusion and inhibition of antigen presentation and the INF factor signaling. So how this Mycobacterium tuberculosis will be affecting us? The acid-fast bacillus, which is called as a Mycobacterium tuberculosis, which is a waxy cell wall with mycolytic acid resisting the standard staining of Zeal-Nielsen's positive. It can cause slow replication where it is 15 to 20 hours of generation time and intracellular survival within macrophages. It can transmit through an air, so it is an airborne droplets, or that it infects from one person. It can affect to 10 to 15% who is come in contact with that one person. And this occurs in the highly population areas, crowdy areas and the lower nutritional areas. And the primary focus is on, it is mainly affecting the lungs, which is affecting the posterior and lower lobes, and this can start developing in the aerobic environment. So here is a structure of a Mycobacterium tuberculosis. You can see the tuberculosis has an villi, cytoplasm, chromosome, ribosomes, cell wall, plasma membrane, capsule, placid and mesosomes. So it is about 2 to 4 μm in length and 0.2 to 0.4 μm in width. The appearance is slightly curved and smooth homogeneous cytoplasm, and it is a polymorphic under stress. The method of staining is Zeal-Nielsen's staining method. So when you see this image in the lungs, you can see a gone focus. So gone focus formation is a major thing which can occur in the lungs. So when you see in this image, you can see a gone focus formation. Gone focus is a small nodular lesions of 1 to 2 cm. You can see in this X-ray a white and yellowish central caseous necrosis will be seen. So this is because of a granular formation on the lower lobes of the lungs. The inflammation of the lymphatic vessels and the draining from the gone focus towards an hilar lymph node occurs. So there are various tests that has been given to find out the active TB and the clinical presentation. So here is a constitutional symptoms that you can note down when the patient is having a TB. When it is a respiratory, it is a major thing, that is the productive cough and the systemic of low grade fever, night sweats and unintentional weight loss and loss of appetite. The pleuritic chest pain or dyspnea can occur. There is a lymph adenopathy. You can see in this image there is swelling in the neck region, or like lymph nodes can cause swell and the bone pain will be noted. And you can see spinal kyphosis, that is an like the curved spine can occur. So the golden standard method to find out the TB is through a sputum culture, and you can also see this cavitation or a gone focus in imagings. And tuberculin skin test was already priorly used for identifying the infection, and nowadays we are going with IgRA, that is interferon gamma release assay. So what could be the management strategies is you want to give an regimen of antibiotics, that is Rifampicin, for a long term of 8 weeks to 16 weeks, and you want to monitor the sputum level for negative presence of an TB. That is a baseline treatment to find out the presence of a TB. So this, as of summary part, you can see that Mycobacterium tuberculosis is 2 to 4 mm in broad, and it can cause a gone focus or a lung nodule and lymphadenopathy and lymphadenitis. The main examination is through the sputum, that is Ziehl-Neelsen staining method, and the clinical features of the patient is will have a protective cough, weight loss, night sweats and fever, low grade fever and hemoptysis. The treatment regimen is you can go with an antibiotics, Rifampicin, and for the prophylaxis we can go for an BCG vaccination as a prophylactic treatment. When you are in a child below 5 years, it is recommended to have an BCG vaccination. Thank you for listening.